Then we go to another one. So this one, Chinese name we call 顿咳. 咳 is cough. 顿 is we use words like we eating one time of the dinner or one type of meal. Means continually, like a cough for some time, and then maybe relieve sometimes, and then they coming back again. So severe kind of cough. So then we say what means for person cough. So they have another name. Yeah, they have another name. Basically, is a respiratory systems disorder, and it caused by bacterial infection. So that's a special kind of bacteria. They cause this special kind of situation. So what happens? Yeah, what happens? If patient got this kind of bacterial infection, they will develop uncontrolled kind of severe kind of cough, and even make the patient difficult to breathe because they just cough, no time to breathe. And after the cough, little bit getting better, then they take a deep breath. So that causes kind of sounds in there. So that's basically for this illness. These illness could be for children, also could be for adults. But basically, it is only severe kind of disorder or dangerous for children under 3 years old. So if children getting bigger, it's not severe, it's not dangerous, still curable. But if under 3 years old, maybe caused severe kind of situations, even possible death. TCM etiology. So that's we're still thinking about attacking by the external passenger epidemic kind of passenger wind evading. And if children's body is weaker and maybe generate some phlegm, so then patient's symptoms may be more severe. So that we'll talk about a different stage later. So basically, we're talking about body 正气 balance with the passenger. When passenger evading, body 正气 strong kind of people or children, they will not get sick or illness. If body 正气 is kind of weaker, they will evade and got a severe kind of illness. So that's we always talk about the body 正气 balance with the passenger seat. So these illness transmissions by the mouth and the nose, like some driplet, yeah, driplet. So that's basically we're talking about Wei qi, defending qi, normally protected of ourselves. So if body zheng qi kind of weaker, and the passengers is little bit more strong, then cause the infection. So if generally children, generally healthy condition, even they got passenger evading, but still can gradually recover, they will not go to second stage. Basically, first stage, pretty similar like we talking about. Jays got a common cold, and then they got it. But children's body zheng qi is kind of weaker. Then they possible go to second stage. So body zheng qi weaker and some phlegm generations, then get all the symptoms is worse. Then they will go to second stage. Second stage is whooping cough stage. So then we're talking about the clinical symptoms here, different pattern and different symptoms here. We say first stage, generally say 10 days to 20 days, attacking that kind of passenger evil. For the West medicine, we say attacking with some bacteria, special kind of bacteria. Like some children have this kind of whooping cough, then other children contacted with the children. So generally say have about 7 to 10 days, children no symptoms. After 10 days, then symptoms show up. So that's why we say 10 to 20 days here. So basically, first 10 days, before 10 days, they may don't have any kind of symptoms there. But go to 10 to 20 days, people will be cough start. And then with other EPI evading symptoms there. So that's cough with some phlegm. That's the mainly symptoms here. Truly, they can have like a fever, aversion to cold, running nose, headache. But particularly for these illness, is cough with some forming kind of phlegm. So that's usually clear, yeah, white color, yeah, clear color. And with visor. Tongue generally nothing changing. Pulse, floating pulse, is stronger there, yeah. Floating pulse is stronger. So that's the first stage. Just generally EPI waiting plus some cough and phlegm and wheezing. So in this stage, our treatment principle, dispersing wind, descending lung qi. Yeah. Cough is the symptoms, lung qi reversed. So that's we talk about descending lung qi. And transform phlegm or result phlegm. So basically it's phlegm accumulations and cause people's visitors cough. So the treatment, So we still pretty similar, like we treat EPI condition, wind attacking, lung 7 LI4 combination, and we can use gallbladder 20. That's the wind points. And also we have a pretty good actual points, 定喘. Stop cough, relieve asthma, and relieve some wheezer. So that's actual points this one. Especially you can use for these conditions. And also if the children is kind of weaker, like generally body constitution is weaker, and pretty easily got like infections. So that kind of patients, we can add in stomach 36. And if patients have kind of lung deficiency, especially we can follow the channel to do some palpations. And if patient have lung deficiency, they will feel tender, especially in back of the lung area. So we can add in bladder 12 or even bladder 13. Bladder 12 is the wind points. Bladder 13 is the back of the lung, so stronger for the lung. And certainly lung 1 still working. But a little bit careful for lung 1. Children's skin is pretty thinner, especially in the chest area, lung 1 area. So basically, if you needle lung 1 for children, I will suggest you don't leave in the needle there. Just put the needle in and do a little bit manipulation, and then we stop needles. Or maybe you just use acupuncture instead of put the needle there, because that's still belong to danger points. So that's for this condition. We're talking about the stage 1. Stage 1. The second stage, that basically happens around 40 to 60 days. So we still have some space, 20 days to 40 days. Every patient's situation may be different. Some people's first stage may be a little bit longer. Some people's second stage may be coming a little bit early. It's totally depending the patient's situations. But generally speaking, most patients around 40 to 6 days, we say that's the second stage. So on the second stage, it's more complicated situation in here. We have different pattern in second stage. Like we say, most people maybe just recovered from the first stage. They will not go to second stage. But if they go to second stage, usually that's a severe kind of situations. So we have the pattern from cold blocking the lung. Severe kind of cough, convulsion kind of cough, just like we talking about whooping cough there. Yeah. continually cough, 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 and then get a deep breath in, and then cough again. So that's means convulsion kind of cough. And asthma. So difficult breathing. And a lot of phlegm coming from the lung, more liquid. And sometimes, yeah, people cough, 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 then they vomiting. Then that cough kind of temporarily reduce, but they will coming back again. So we say vomiting relieve some phlegm. So get the symptoms let it be better, but they will coming back again. And possible have nose discharging, but mainly is cough phlegm. Tongue coating, tongue body generally nothing changing. Tongue coating, you can see some green, some tongue coating. And the pulse still floating and tight. Tight pulse, we say, is the cold condition. So still coming from passenger, coming from external, even passing 40 days, external passenger still not relieving yet. And the body zheng qi still fighting with passenger on the superficial level. So that's pulse still floating there. So our treatment principle, warming and dispersing lung qi, is truly some cold inside. And stop cough and transform phlegm. So the points, we can use bladder 13 back through of the lung to tonify the lung, make the lung qi stronger and descending lung qi there. And then 12, transform phlegm. That's mainly transform phlegm in the middle jiao. We say the children also may have nausea, vomiting. And also, then 17, we specially transform phlegm in the upper jiao. And still don't remember, don't forget, we have actual points, 定传, still working there. It's very powerful kind of points. This condition, cold inside, we also can use maxa. And maxa on garlic. Garlic is hot natural. And garlic can relieve some external passengers. So that's you can put garlic, cut pieces of garlic and put it together and above it, put some maxa. Usually you can do on Ren channel, like Ren 8, Ren 12, even Ren 17. So that's put some maxa there. Another pattern, second stage, phlegm heat damaged the lung. So that's a combination pattern, phlegm and heat pattern. So the phlegm is most leaky. more difficult to cough out because the heat makes it more sticky there. And even maybe some blood in the phlegm. And the patient also, if heat more severe, also possible can cause the bleeding from the nose. And the mouth is more dry and more thirsty, and try to drink more water. Tongue could be let be red tongue there, and a yellow dry coating. Pulse, sleepy pulse coming from phlegm, rapid pulse coming from the heat. So that's heat combination with the phlegm there. So treatment principle, clear heat and dispersing lung qi and stop cough and transform phlegm. So basically our treatment principle will follow our pattern. So the points, PT6, we can use with Ren 17 together. Open the chest. And LI4 still with lung 7, like a pair point. Open the lung. And the lung 9, tonify lung qi, dispersing lung qi. And the patient with heat phlegm combinations, we can use LI11 to clear heat and phlegm heat. Certainly, we can add in more points for the phlegm, like stomach 40, maybe spleen 9, transform phlegm. This condition is a little bit severe kind of condition. So we can use bleeding technique. To like cause a few drips of blood can coming from Dingwell points. Yeah, bleeding there. And another pattern is still on the second stage. We say second stage is more complicated stage. It's by the patients like originally underlying body condition, like constitutions. So they make out a different pattern here. Like a patient long-term have deficiency kind of problems. On the second stage, they are pretty easily go to like a deficiency pattern. If patient generally not too stronger deficiency there, they are pretty easily got excessive pattern. So lung and spleen qi deficiency pattern, they still cough, but the sound is weaker and generally body weaker. The phlegm coming out is not that big amount. Small amount is more watery. And the patient have qi deficiency symptoms, short breath, and generally pale. Body is very thin. like a poor nutrition kind of patients. And like have a history about poor appetite. That means originally spleen qi deficiency, maybe for a long term already. Pale tongue deficiency tongue. White tongue basically is kind of phlegm or dampness accumulation. Generally say it's no heat there. Pulse is weaker pulse, deficiency pulse. Soft pulse is a kind of phlegm retention kind of pulse. When we're talking about spleen qi deficiency, spleen qi control the function, TNT function. So spleen qi deficiency kind of patient, their TNT not working. So pretty easily cause water retention, dampness of lung. So treatment principle for these patients truly we need a tonified lung and tonified spleen and stop cough. So we have a lot of tonified points, like Yuan South points of the lung and the stomach 36 pretty good qi tonified points, and the spleen 6 spleen tonified. Back through of the lung, even you can use back through of the spleen, and we still can use actual points 定出来. Also for this condition, we still can use Maxa. So Maxa we talking about before. Ren 4, Ren 6, Ren 8, or even maybe backroom points. Generally, that's we need more tonified for the children. They have more deficiency kind of conditions. And the patient also possible indifference. So still patient have chronic indifference, then attacking by the external passengers. In that kind of case, they are pretty easily go to indifference pattern. Indifference causes cough, dry cough. Sometimes even can have a little bit amount of blood inside, bleeding, but not a big amount, just small amount, just small amount. And generally weaker, generally body weaker. 5 center heat, indifference symptoms, 5 center heat. And generally restless. And pretty easily waking up at night because different heat there, disturbing sleep. And generally irritability and night sweating. So they still have general symptoms relationship with indifference and red cheeks. So yeah, excessive heat causes the whole face red. but deficiency heat, they cause the face red, just like here and here. Like some people make some makeup there. And the dry lips, deficiency heat damage body fluid, so make the lips dryness there. Tongue, thin yellow coating there. Yeah. Indeficiency, could be without coating, could be thin yellow coating there. And the pulse, rapid foresight. That means deficiency heat pulse. And we can look in the fingers vein for under 3 years old. It's thinner there, means deficiency. And the pupil color, that's a heat accumulation or maybe blood stasis. So we need to see other symptoms, but this pattern mainly is in deficiency pattern here. So treatment principle, we need nourishing in and moistening the lung, because deficiency heat is damage body fluid and also make the lung dryness. The acupuncture points. So basically, we need inner shin, 3, 6, kidney 7. Also, you can use kidney 6 together. Lung 9, 原 south point of the lung. And the kidney 3, kidney 25 there. Blood 23, still kidney 25. Back through of the kidney. So generally, we're talking about indifferency. It will look like mostly is lung indifferency there, but generally body in more close relationship with the kidney. And also we're talking about this illness is more severe when the patient under 3 years old. Young kids have problems, mostly relationship with kidney access defects. So that's basically we go to lot of kidney points here to nourishing. So that's mainly, that's mainly happens on the second stage by the children's different kind of conditions. They may have different kind of symptoms. They may go to different patterns. So some children still can recover, still can recover. But some children may be still not totally recovered, like passing 60 days, like a patient still cough. So that kind of condition, basically we call third stage. Third stage, basically generally is deficiency stage. Patient sick so long time, about 2 months already. Whatever the originally body, how stronger it is, now is caused weaker already. Especially some children, they originally have some deficiency kind of conditions. So during this stage, basically body 正气 is weaker. And the passenger qi is weaker too. It's not that strong. So that's the symptoms. It's kind of reduced. Mainly symptoms, deficiency symptoms there. So short breath, weaker voice, lung qi deficiency. And patients still cough, but the phlegm amount is decreased, small amount. And generally body weaker, pale face, very thinner, and possible poor appetite, losing stool. So we possible have some other deficiencies there. Tongue is pale and moist in there, tongue coating. The pulse is weaker pulse. So that's the mainly pattern for qi deficiency. Qi deficiency pattern, we need to tonify qi. Tonify spring qi, tonify lung qi. For children, always connected with 2 tai yin together. So hand tai yin is lung, foot tai yin is the spring. They are functionally pretty close relationship. When one deficiency, another one will be deficiency. So the points, still like Yuan Shao's points, Lang Nan, 45. And the Lang 5 is the water points of the lung, moistening lung, descending lung qi, stop cough. Stomach 36, qi 25. Bladder 13, 白术的lung, 25的lung qi. Bladder 20, 白术 of the spleen, 25的 spleen qi. We say we never separate 2 tai yin for children. Always thinking about 2 tai yin together for children. That's the repeated point here. And still, still 定喘, If patients still cough, we still can use 定喘. And Maxa is good for this condition. We say we can Maxa by through the lung. And the back through of the spleen. Also still some Ren points. Ren 6, Ren 4, Ren 8, generally tonify there. So that's for this pattern, qi deficiency of the lung and the spleen. Then we go to the pattern. Yeah, we go to the pattern. Yin deficiency. So both qi deficiency pattern and yin deficiency pattern both are our second stage and a third stage. Generally speaking, second stage still passenger strong stage, but may have some deficiency symptoms there. But third stage, more deficiency compared with the external passenger evading. There is still possible cough, but not that severe anymore. When they show up, it's deficiency symptoms. We say yin deficiency, night sweating, 5 center heat, and still cause the patient restless and waking up at night. And the heat causes the patient irritability. Still red checks the area and dry in the mouth, also in the lips. Tongue still thin yellow coating there, slightly heat in there. Deficiency heat compared with excessive heat. Deficiency heat is not that stronger heat, but it is still heat. Pulse still rapid, but force less. If we looking the fingers, looking for the vein we talked about before, heat in there causes the pupil color. Cold in there is the red color, or slightly red color. And the thinner there, it means difference. So treatment principle, we need nourishing in and moistening the lung. Lung is the organ. They don't like dry. They always need moistening. But couldn't too moistening. Too moistening, they will generate the phlegm. So that's the problems of the lung. And the acupuncture treatment, we still can go to Yuan south points of the lung and the bladder 43. Pretty good nourishing 25 points. On the second line of bladder channel. So that's pretty nourishing points. Severe kind of deficiency, we always can go to that point, can nourishing. And the bladder 23, kidney 25, kidney 3, kidney 25. So to see patient have some other symptoms. If they still have other symptoms, like a cough, we still can use like a 定喘, can stop cough, or maybe lung 5, more for lung moistening there. So that's for these points. So that's sometimes 5 points we need thinking about. So in meridian, Well points start from the wood. So you calculate from there. Well in spring, that's fair. Stream is the earth. River is the metal. And the Hershey point is the water. So truly long 5 belong to Hershey point is the water point. So it's stronger than moist in the lung. And the bladder 23, kidney 25. We're talking about the indicacy, mainly relationship with kidney. So kidney 25 points. Prevention. So this illness is a little bit severe kind of illness. It's not like a chickenpox. Basically, try like got some children get some infections. So isolated the children. And in the early stage, like first stage, they find the symptoms there. And also go to convulsion kind of cough stage. That's like a second stage there. Both these two stages, they will transmit illness to others. So basically, so some people meeting the children with sick children, they need watching for 21 days. They say the illness is not directly go to like convulsion kind of cough. They have some time hiding the symptoms, but they may transform the bacteria to others. So that's what we're talking about isolated and watching. And vaccine. Yeah, vaccine. Truly, we have effective vaccine can use for children to prevent this illness. So that's vaccine will be working. And still, for this illness epidemic time, try not to go to public place. So that's still like other infection kind of illness. So that's the way we preventing the illness. Don't go to there. Like still like right now we talk about COVID-19. Stay home is the most safety way. Especially for children. Yeah. Children's stomach organ is weaker. So try not to carry them go like everywhere. So sometimes I think from last year, when COVID-19 infection start, like no many people go to the bars, even no children go to bars. But right now, like more and more children carried by their parents go to bar. Truly, it's thinking about look about right now is a little bit better, but still dangerous for the children, especially right now, like not many children with the mask and the mask for the children still not a good idea. But truly, still some public place Still better, try not to carry children go to them. So that's basically for transmission kind of illness. We need pretty be careful for the children. Then we're talking about the nursing care. So when the children have a convulsion kind of cough, the same meaning, whipper cough. So during that time, prepare the food for the children, easy digestion, and not greasy food. That can generate more phlegm. So pretty like easy digestion, like rice congee, and more fluid, more vegetable. They will have a lot of vitamin inside and give children enough nutrition there. Don't give too much meat. So meat truly can generate more phlegm. And also keep the room clear with sunshine and ventilating. Like every day open the window or open the door for about 5 to 10 minutes and then close it. Yeah, in case the patient got a second infection by the wind. So we need to open the window to like a fresh air go in, but not too long time. And keep the environment quiet, easily for children recover. And clear, no dust, no smoke. So that's basically, and also sometimes eating maybe trigger the cough. We need to be careful. And keep the children more rest. Generally say not go out. But if warm day, yeah, if warming day outside sunshine and go to outside, don't go to the people. Yeah, don't go to people. So that's still basically good for the patients. And the emotion, don't like children, pretty emotion, like, yeah, cry, don't like them cry. So that kind of emotion changing also can cause the children cough. So that's basically for nursing care area.